Hey everyone, I'm Tim Daisy, Medicare and Retirement Specialist here at Gruning Health and Wealth. If you're approaching Medicare, already turning 65, or helping someone about to navigate the process, you're in the right place. One thing I've learned after helping hundreds of people enroll in Medicare is that the people who have the smoothest experience aren't the ones with all the answers. They're the ones asking the right questions. So one of the most common questions that we get is Medicare Advantage versus Medicare Supplement. Which one's right for me? Well, let's take a look. So let's start with original Medicare. The first part is Part A. Part A is going to be your inpatient coverage. So that's for your hospital stay, when you're actually admitted into the hospital. Then we've got Part B. Now, Part B is outpatient coverage. So your doctor visits, a lot of surgeries today are outpatient surgeries. So that's going to be covered under Part B. Now, Part B is going to cover all your Medicare-approved expenses up to 80%. That's going to leave 20% up to you, and there's no limit to that. So we're definitely going to want to address that. And then the third part is Part D. That's your prescription drug coverage. Now, I know there's Part C missing here. We're going to get to that in just a minute. That 20% left over from Part B, there's a gap there. The Medicare Supplement is often called Medigap. So you notice we've got A and B and D. Well, where's C? Medicare Advantage is Part C. Part C combines A and B and oftentimes Part D. And we call that Part C. So let's compare the two. Now with the Medicare Supplement plan, you're going to have all the freedom and flexibility to go to any doctor or hospital that you want. As long as they take Medicare, they're going to take your supplement plan. That's about 98% of the doctors and hospitals in the country. So you have no networks. That also means no prior authorizations. We are going to need to add a Part D with the supplement plan, but it's going to be the most freedom, but a little higher monthly premium. Medicare Advantage. A Medicare Advantage plan is going to be lower monthly premium, but a little higher out-of-pocket cost. Kind of a pay-as-you-go, probably very similar to the employer plan you've been on for years. There is a network, so we're going to want to make sure we identify your doctors and find a network that's going to be right for you. Part D is usually included in a Medicare Advantage plan. There are some that aren't. We're going to help you find that, as well as some extra benefits like over-the-counter benefits, credits at your local pharmacy, silver sneakers, gym memberships, and dental, vision, and hearing are usually included parts of a Medicare Advantage plan. So let's compare the two one more time. Supplement plan, it's going to be a higher monthly premium, lower out-of-pocket costs, freedom and flexibility of no networks. Medicare Advantage is going to be lower monthly premium, a little more out-of-pocket costs along the way, but it's going to include some benefits like dental, vision, and hearing, silver sneakers, and over-the-counter benefits. I hope this video answered a few of the questions you've had about Medicare and helped you feel a little more confident about the road ahead. If you found this helpful, make sure and like the video and subscribe to the channel, and leave your Medicare questions in the comments below. We love hearing from you, and your question might even become the next topic in the future video. If you'd like more personalized guidance, we've included links in the description below where you can schedule a free one-on-one consultation with one of our Medicare specialists. Download our free Medicare and Retirement Planning Guide 64+. Thanks so much for spending time with me today, and I'll see you in the next video.